Hey everybody, Luke Gordon, physical therapist here, and in today's video we are going to talk about the single most common cause of shoulder pain. So if you've seen some of my videos on shoulder pain, you've seen this lovely model before. I'm going to explain this in just a minute. And you've seen a lot of videos on things like rotator cuff, tendinosis, supraspinatus, infraspinatus, how to strengthen the arm and things like that. And I really don't have a video yet that just says, hey, this is the most common cause of shoulder pain. So I want to just dive into that one specific topic in this video, be a pretty quick one. And again, I'm going to use my shoulder model to help explain what it is and how it happens for the most common cause of shoulder pain. So first of all, simple answer to the question, the most common cause of shoulder pain, the diagnosis, is rotator cuff inflammation. So rotator cuff tendonitis, So rotator cuff tendonitis, which just means that it's irritation, which is the itis of a tendon of one of your rotator cuff muscles. More specifically, the most common rotator cuff muscle that's going to have tendonitis is your supraspinatus, which on this model is my pink kinesio tape. So I'll explain that in just a minute. I also have the other videos on supraspinatus, tendinosis, and things like that, which I'll link at the end of this video. But anyhow, your supraspinatus is one of your 4 rotator cuff muscles. This is a right shoulder. So this would be anatomically on me. This is the collarbone in front. This is my humerus, my arm bone. This is my shoulder blade here. So if we flip it around and look at the back, along the top of my shoulder blade, that pink muscle, that's the supraspinatus. If I were to touch it on me, it's coming down through here. So underneath this bone out here, that's the bone right there that you can see. That's your acromion, which is part of your scapula or your shoulder blade. So again, we've got your supraspinatus sitting on top. It's one of your 4 rotator cuff muscles. It's the one that's most commonly involved with inflammation, bursitis, tendonitis, more chronic damage like a tendinosis, and then most commonly torn muscle too in your rotator cuff. So if you know someone who's had a rotator cuff repair, or you have, the tears are usually in that supraspinatus muscle. So tendonitis is the most common cause, and basically what that looks like is that you are just kind of going along with your normal day-to-day life, and over time gradually your shoulder starts to hurt. Now, it might at first just be certain movements, like reaching across your body, reaching behind your back or into like the back seat of your car, reaching straight out to the side, stuff like that. So at first, it's just specific motions that hurt, and then over time, it just starts to hurt all the time. And so it's just a very gradual onset of pain, and most people are going to say that it hurts kind of along the outside of the shoulder, kind of down to the deltoid, maybe down as far as your elbow, but not typically beyond the elbow or anything like that. Just kind of a vague pain out here. People kind of rub their shoulder, even though the pain is coming from up here, it refers down. So again, that's your most common cause of pain. Now I want to just explain too, why does it happen? So basically what happens is, as I was showing you earlier, that top muscle, your supraspinatus, is sitting underneath your acromion. Now, as you're doing different types of movements, you're reaching, you're lifting, it's mainly reaching things that will get you. Over time, you just get a little bit of irritation as your arm is moving up, and your supraspinatus can start to get pinched a little bit. Now, it's not a big deal for the most part for it to get pinched a little bit. Typically, as your arm is rolling up, it's a ball and socket joint, so your socket is rolling up in the ball, but it can just kind of roll up to the top of that socket. The ball is rolling up in the socket, and it can start pinching that supraspinatus muscle. So again, over time, it's just a little bit of irritation that starts to stack up. And the thing that really works against people with shoulder pain is that with another type of muscular injury, the irritation would just heal overnight. But the rotator cuff muscle on the top here, your supraspinatus, it just doesn't heal very well. And that's primarily due to poor blood supply. So again, you just get a little bit of irritation over time, couple things you did wrong today that just kind of tweaked it, pinched it, and then it's just not healing. So over time, the scales are just kind of gradually tipping until one day you hit kind of a threshold and all of a sudden you have pain. Now, you didn't really know you were even getting close to that threshold until you went beyond it, but now you've got pain. And again, the typical presentation is you just have pain at first with certain reaching activities, across the body, behind the back, straight out to the side. And then as the pain starts to slowly worsen over time, then you start feeling like when you reach out in front, now you can no longer reach overhead like to put something in a cupboard or just reach out in front of you or something like that. So that's your typical presentation of shoulder pain. Again, it's rotator cuff tendonitis. Most specifically, it's supraspinatus muscle tendonitis. And then if you watch some of my other videos on shoulder pain, I kind of talk through how there's lots of things that compound this problem. And the biggest one, which I've got a video on this too, is that when you start to really cross that threshold and get pain on a more consistent basis, your natural response is typically going to be to avoid things that cause pain. And for a lot of people, that means they just completely rest the shoulder. And I've got another video on that, so you can check that out, why rest is actually really bad for your shoulder. So you don't want to do that. But again, I'll leave that for another video. But anyways, that's just how it goes with shoulder pain. The good news is it's very treatable. I got a lot of videos on that too. I'll link a couple at the end here if you're interested in learning more about that supraspinatus and then just how to treat shoulder pain and things like that. So I hope that helps you. And please leave a comment below the video before you go if you found that helpful, or if you've kind of come across a similar pathway with your shoulder pain where it just starts real gradually and then it kind of worsens over time. So anyways, I hope that helps, and best of luck with your shoulder pain. Thanks for watching. Bye.